Hi, everyone. Welcome. Thank you so much for making the time today to learn more about oral health. I am Denise O'Connell, the Associate Director of the Leonard Deneen Health Education Alliance of Maine. We're a program of Massachusetts General Hospital in Boston and the Slavin Academy for Applied Learning in Healthcare. And with me today are my colleagues Tara Wilson, Samantha Knock, and Labrini Nelligan. And since 2011, for those of you that don't know, Leonard Deneen has been providing education on critical public health problems where we know education gaps exist. And there's no cost to Maine participants. And the organization was made possible through the vision and generosity of the hospital, but also the Lunder family and the Lunder Family Foundation. And our charge has been to improve health by providing continuing education to health professionals. And the funders had strong ties to Maine, hence the Maine focus. And this has been a unique initiative where we've connected one major academic medical center with a neighboring rural state. The first 10 years of our work was providing programs for healthcare professionals because lifelong learning is essential for them to provide good care. But most recently, our newest program is totally consumer focused, and that's called Motivate at Home. And today is a session that is a component of that program. Next slide. We want to let you know that this session is being recorded. It will last for 30 minutes. We'd like you, if you want to turn your camera off, you can. If you feel more comfortable, ask you to mute unless you have a question, and then just let us know by raising your hand. You can put questions in the chat. We have some questions pre-prepared if you're uncomfortable asking. And at the end, we'd really love your feedback because you will shape future iterations of this program. So at the end of this session, we'll put a survey link in the chat box and ask you to complete it. And once you do, you'll get a $5 gift card via email. So don't log off till we get to that, please. The next slide just lets you know that this is an education program and not intended to render medical advice. All right. As I mentioned, we have developed a fully total consumer focused program called Motivate at Home. This new program teaches the importance of oral health and also teaches caregivers and care partners of older adults what their role can be for promoting and providing oral health for an older adult that lives at home. The program was funded in part by the CareQuest Institute for Oral Health, and it was modified from our nursing home program, whose results are now published in the Journal of Public Health Dentistry. The program was based on preferences for caregivers that we surveyed all across the state. And they told us they would love a website where they could go 24/7 to learn, but they also wanted a live learning component. And that's why we started this Ask the Dental Expert series. While this program primarily focuses on caregivers, the content is valuable and relevant for all people of all ages because we have a long way to go with oral health literacy, even among healthcare professionals. The next 2-minute video will explain the program a little bit more and how it was developed.
Hi, I'm Carol Higgins Taylor. I help and provide support for my mother, who's in her 90s, even though she still lives independently. It's called being a care partner. If you're a care partner like I am, you might be interested in participating in a new program, Motivate at Home, which is very helpful. I love that the program was developed by health experts and organizations right here in Maine, so they know Mainers. The program is designed to teach people how to provide oral care for a loved one. Even if you don't personally provide this direct care, you'll learn how to promote oral health care for your loved one and others who may be in their situation. Caregiving and care partnering can be difficult. Like me, if you have conflicting feelings about your loved one's oral health or lack thereof, what I've learned is that it's never too late to address oral health. It's better to start somewhere and do something than do nothing at all. This program helps get you started. The initial Motivate program was developed for health professionals who care for nursing home residents. The videos and posters from that program were modified for people like us who are care partners. They created a survey, held focus groups, and spoke to care partners across the state when developing the Motivated Home program. The best part is that the Motivated Home program is free. This website is very easy to use and has all the education someone needs to complete the program. There are no other books or materials required. The website has brief videos, posters, audio recordings, and other resources. The videos can be viewed at any time at your own pace, and the posters dispel common oral health myths. You'll learn tips for providing oral care for someone who has dementia or is otherwise resistant to care.
All right, so I love that video. So I'm honored to introduce our guest speakers for today's session. We have Dr. Adrienne Lapdos, who's a licensed clinical psychologist and clinical associate professor with the University of Michigan Medical School, Department of Psychiatry. Her research focuses on innovations designed to improve access to care, especially those led by community health workers that integrate physical, behavioral, and oral health. As a practicing clinical psychologist, she provides psychotherapy and evaluation services to individuals living with mental health diagnoses such as schizophrenia, depression, and PTSD. As well, we have Dr. Danielle Ruley, who is a registered dental hygienist and associate professor and director of the Master of Science in Dental Hygiene at The Ohio State University College of Dentistry. Dr. Ruley's research endeavors focus in the areas of interprofessional education and practice, particularly the intersection of oral health and behavioral health, and non-surgical periodontal therapies. Dr. Ruley was an invited contributor to the Oral Health in America, Advances and Challenges, the landmark follow-up to the 2000 Surgeon General's Oral Health in America, published by the National Institute of Dental and Craniofacial Research. She maintains an active clinical practice. So today they're going to provide an overview of trauma and its impact on oral care. And then we'll open it up to questions. And again, like Denise mentioned, we do have some questions already populated for those who may not be have any questions. So I will turn it over to both of them to present, and then I will wrap it up by putting a survey link in the chat and ask that you complete the survey because your feedback is very important to our program. Thank you.
Thank you so much for having us here today. We are thrilled to be here to talk with you today about trauma and oral health. So just to give you a little bit of a preview of what to expect, we're going to first start with what is trauma, what do we mean by it, defining our terms. Then we're going to say, like, why is it important to understand trauma from an oral health and dental point of view? What is the relationship between these things? And finally, how might trauma interfere with seeking dental care, as well as interfere with dental self-care as well? I'll be handling the first part of this presentation, and then I'll be handing it over to Dr. Ruley, who's going to delve more into the dental care aspects of what we are discussing. I'll tell you a little bit more about myself too. I'm a researcher, but I'm also a therapist, and I talk to people who've experienced traumatic events as, a large proportion of my practice. And what I've learned is that trauma can affect people in really unexpected ways. And when Dr. Ruley and I first started doing this research, we weren't sure what we would find in terms of the linkages between oral health and trauma, but what we found was powerful. And the extent that exposure to traumatic events, whether they're medical in nature or not, the extent that that affects people's ability to really engage in dental care has been pretty impressive. And I think that there's a lot that we can do to improve the oral health of people who have had traumatic events and improve their access to care. Next slide, please. So let's define trauma. There are different definitions of trauma based on, different organizations will define it slightly differently. And the definition we're using today is from the Substance Abuse and Mental Health Services Administration, and it says individual trauma results from an event, series of events, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has a lasting adverse effect on the person's functioning and mental, physical, social, emotional, or spiritual well-being. So this definition is a good one because it encompasses a lot of elements of trauma. And the adversity that somebody can face can take a lot of different forms. We can talk about military trauma, we can talk about sexual trauma, we can talk about emotional trauma. Traumatic events can happen a single time, or they can happen multiple times over the course of somebody's life. But I want to call your attention to the middle part of this definition, which says that it has lasting adverse effects. And I'm going to get into that a little bit more on the next slide. Advance one. So why is it that we should understand trauma? Why is it important for us to know about it? By this broader definition, over 220 million Americans have experienced trauma over the course of their lives. So in our opinion, it's not so much about if you will know or work with a trauma survivor, it's when. And that is because of the prevalence of trauma in our society. Many of you may already know that trauma affects people's psychology and mental well-being. It affects people's ability to trust. It affects people's relationship with power and control. A sense of intimacy with another person can become very fraught in the setting of trauma because the person's trust has been shattered in the past. Many of you may already be aware of the psychological effects of trauma because I think that has pretty much entered the mainstream in terms of trauma affecting people's lives. But what you may not know is that trauma affects people physiologically as well, with these direct biological linkages. Exposure to traumatic events can sensitize the body's physiological stress response system. And hormones like adrenaline, cortisol, and oxytocin can all be affected by trauma. So it's not only that these hormones are activated during a traumatic event, but after the event is over, the body's physiological stress response system can continue to be impacted by that event or that series of events. And what that can do is cause more emotional and physiological reactivity to new stressful events. So somebody with a prior trauma might respond differently to a stressful event today than someone who has never had a traumatic event over the course of their lives. Next slide, please.
So thank you, Dr. Lapidos. I'm just going to talk a little bit to you about how trauma can potentially affect dental care. We can't have the expectation that somebody is going to land in the dental chair and tell us what their trauma has been. But frequently, if we're attentive clinicians, we can pick up on those body language cues of the person that's in our chair, and we might be able to pick some things out of their medical, dental, social history. So we have to kind of be aware of the other things that they're displaying to us if they don't share their trauma with us. But as Dr. Lapidos said, it's not a matter of if, it's when we come across people seeking oral health care who have experienced some trauma. One thing to understand is that they are much less likely to have preventive care, cleanings, those sorts of things, just by the nature of what oral health care is. It's very much in your personal space. A lot of people associate it with pain, and the trauma does not have to be a dental visit trauma. I mean, there are people out there who have that, but we also need to understand that as the more older a person gets, the more trauma they might experience. So it's not just a one-time thing. People might experience trauma on several different occasions. So we need to understand that when people are anxious about approaching oral health because we are in their personal space, they are in a vulnerable position when they're being in a dental chair. It makes them want to avoid that physiologic reaction that Dr. Lapidos talked about can be triggered. Particularly sexual and physical trauma often involves the head, neck, face, mouth area. And so having people in that space and being touched in that area can be an extreme vulnerability and elicit a trauma response from our patients. So we need to keep that in mind. Additionally, because of that avoidance with the anxiety and that trauma, they are probably experiencing some shame about the state of their mouth. I think as an oral health provider, we all have had patients that come to us and they'll say, my mouth's a mess, I haven't been taken care of. And those are just people who don't have those experiences. When somebody has trauma, there's a lot more layers there. So when somebody brings that to our attention, that should be a flag for us to consider whether or not this is potentially a trauma response. They also may have experienced some stigma from previous oral health care because of their avoidance and the state of their mouth. So we need to be non-judgmental and approach them in a comfortable way for them. Even easy dental care, including just a cleaning or an X-ray, even just looking in and doing an exam can elicit trauma. For example, when we have somebody in our chair, we lay them back. The providers are behind them. If there's a dentist and an assistant, they have two people behind them. In dentistry, we try to avoid patients seeing certain things coming towards them if they need, anesthesia, because we don't want them to see that and get anxious. So then it's kind of a surprise. And so that laying back is vulnerable, and then having people in your mouth where maybe you may not be able to escape, or even inadvertently it's uncomfortable. Sometimes the sensors that we use for radiographs can be uncomfortable, so it can elicit pain. And we do the best that we can, but we need to think about those things and how they may impact somebody who's experienced trauma. Next slide, please. So all of that to say is to not only be attentive to what that patient might need and minimizing that, but we want to take care not to re-traumatize them during an appointment, which is entirely possible. And unfortunately, obviously that could lead to further avoidance of care. And we really need to think about also, if a patient comes in and we haven't been attentive to that, and we've done a treatment plan and they have an appointment and then they no-show for that appointment. Is it them being irresponsible, or is it a response to trauma that has been re-elicited? And so how can we approach that patient without being for sure, if we don't know for sure if that patient has experienced trauma, how can we engage those no-show patients and try to get them to come in for the care that they need? Extra empathy and accommodation are definitely needed. So in the event that we do have somebody that expresses to us that they have experienced trauma and that they have trepidation and fear and anxiety about that, we need to understand that we are not therapists, and that's not what any of this is saying to you. So you're not the therapist. However, we can approach them with empathy and understanding and acknowledge their experience. If they're not telling us, we need to be open and attentive to their body language. Some things in general, kind of like PPE for approaching oral care, explain what you're doing first. If you're planning treatment for them, explain to them what that's going to entail, what's going to happen, what that's going to look like when they're in the chair. I'm going to put you back. First, I'm going to take a look with my Explorer, and I'll be, touching your teeth with it. I'll be doing a head and neck exam if you're doing your oral cancer screening, explaining to them what you're doing and why. Also asking permission first, even if you are trying to elicit a history from them. Do you mind telling me about your previous dental care? Do you mind telling me about your home care? Giving them some control of the situation. That's really important, is partnering with them and giving them a feeling that they have some control over their situation. Invite feedback from them. How do they feel about that? If they don't want to be put back, what can you do for them? How can you meet in the middle for the treatment that you need to do? Even music choices can also matter. So if you are having Sirius XM in your office, be careful about the music that you're choosing. That is fairly neutral. Other things can be what is the age, generational differences of the people that you're dealing with. But always when you're dealing with adults, regardless, please treat them and speak to them as an adult. And when you are talking to them, I like to sit down in my chair and talk to them so that our faces are on the same level. Not me talking to them behind them, or not me standing up talking down to them when they're in the chair, because that is also a body language of power and vulnerability. So just simple changes like that can help you. And so I think the next slide will lead us into some questions you might have for us. So how do I create a safe and comfortable environment for somebody with trauma? I just went over several of the ways that you can do that. I think I got a little bit ahead of myself. But again, your body language, how you're even communicating to them. If you're just all business, that can really be intimidating to somebody who really isn't familiar with what's going to happen. Also, you need to think about the person, and one thing we don't think about a lot in terms of oral health care is grief and loss, and how even losing a tooth, if a tooth is hopeless and it needs to be extracted, a lot of times we'll get that pushback from those patients where they don't want to have that tooth extracted unless it becomes like an absolute emergency necessity. And that's because they're losing a part of themselves. It's a feeling of a loss of control, and they might already be dealing with grief and loss, especially if they're older adults. So are there any additional questions about creating a safe environment?
Thank you so much, both of you. The information is so important, so timely. Encourage you to feel free to put questions in the chat. We are a small group, so if you do want to go ahead and ask a question, feel free to do that as well. Otherwise, we do have prepared questions that we can go through.
Actually, Dr. Rulli, I had something I wanted to say in response to your slide, because the music choices piece has always been kind of interesting to me. I talked to a lady recently with a history of trauma who told me a story about how she went for a dental visit and the song "Don't Worry, Be Happy" was playing in the background. And she found it very distressing, let's say, because the appointment was very distressing to her. People were talking about extracting her teeth. People were talking about how poorly her mouth was doing. Her trauma response was activated because she had a history of sexual trauma, and she felt very vulnerable lying there in the chair. And she wanted to tell them to turn off the music, and she didn't feel like she could. She didn't feel like it was within her right as a patient to say, you know what, turn off this music. It's driving me nuts. So it's not always that, like, I think even a pretty neutral song can be triggering for someone if they have a weird memory associated with the song, or if it's just a strange association for them, they're not liking it. So sometimes it's hard to anticipate what exactly will trigger somebody. So exactly what Dr. Rulli said, centering choice is the only way to address that. Because even the most bland, neutral song you pick could have a negative association for someone. So telling them from the get-go, I'm going to play some music, but you know what? If you want to change, just raise your hand, let me know, and we'll swap that out or play nothing at all. But it's really up to you. And centering their choice and their control in it is one way to address the ways that we can't always anticipate how somebody's going to be triggered. I mean, who would have thought the song Don't Worry, Be Happy would be so upsetting to somebody, but it was to her.
This is Andrew. I do have one question, if you wouldn't mind. Do you recommend any kind of screening questions that's not too intrusive to allow patients to maybe share their experience if they feel comfortable? So we can maybe be aware of it without being too insensitive or being too intrusive about their experience?
So I will say I've heard so many different things on this matter because there are some clinics who really feel like they're not equipped to deal with a positive answer if they get one, in which case it's hard. I mean, it's hard to ask and then feel like you don't know what to do next if you get that positive response. I know that it is on some clinics' paperwork that you could disclose a history of trauma if you have one. I think to step back from it, one of the important things would be to have a plan for what to do and for the staff to feel like they're equipped to have a brief conversation with somebody without opening up too much, and to figure out what the referrals are and what to do next and how to support the person in the event of a positive response. Danny, in your clinics, do you ask screening questions of that nature?
We do not for those reasons, and particularly in the school because we have students, and that is the students need to learn how to approach trauma-informed care, but in those situations, it's a little bit above too much for them. And what do you do when you have that response, right? Do you have referrals on hand? Those sorts of things. So those are really great questions. Dr. Lapidos and I did partner with the National Council on Mental Wellbeing for a couple of articles that were in the California Journal, Dental Journal, and it was on behavioral health and oral health and how to kind of integrate that into practice. I think there were some really good tips and tools and resources in those articles. Maybe we can send those to the team and have them make those available.
Mm-hmm. I think that's a great idea, Dr. Rulli, just to make the resource available to people and they can decide whether, like in their local setting, it would be safe to ask.
We do have a question in the, go right ahead, Andrew. There is a question in the chat. Do DDS and do dentists and hygienists programs include working with patients with trauma backgrounds as part of their curriculum? Good question, Marla.
That is a great question. Not specifically, no. Some programs do have a behavioral health component, but not every dental program, and most dental hygiene programs do not.
Other questions, comments? Did we want to go over the final slides that have questions? I know we're at the end of our time. I can't remember what they were.
We do have a question in the chat from Nancy Foster. Do certain medications help with stress and anxiety?
So yes, there's medications that are prescribed for stress and anxiety, it tends to be the case that the short acting ones are not really appropriate for long-term use. There's addiction potential, you know, your Xanax and your things like that. It's so if somebody has like a chronic stress problem, such as generalized anxiety disorder, it's actually more common to prescribe what's called an SSRI, which is most commonly thought of as an antidepressant, actually. So yes, but sometimes when there is an acute stressful event that will probably resolve, then those short-acting anti-anxiety medications can be appropriate. So for example, for a medical procedure where somebody ordinarily isn't that anxious, they need to get through a procedure or a flight, you know, like they have to get through a plane ride or something like that, then sometimes those more short-acting medications can be used.
That was a
Excellent.
great question.
That was a great question. I think let's go to slide 16, if we could. I think, Tara, you have 2 more slides. If you could kind of walk us through the closing, because the fact that you're here means a lot, that you're interested in this topic. And as I said, we have a lot more to learn about oral health and particularly trauma and the intersection. So we want to make sure you know there are other topics coming up where you can learn even more and share it with your family and friends. So I'll turn it back over to you, Tara.
Thanks, Denise. Yeah, you can see that we have 2 additional sessions coming up, one on November 14th on medication's impact on oral health, and then November 21st, oral health and the body. I do want to thank Dr. Lapidos and Dr. Ruley for speaking today. Just really important information. So we were so thrilled that you could participate with us. And certainly if anybody would like to attend our future sessions, you'll get an email reminder that you can just register for. And if you have friends or other healthcare professionals or family that want to attend, you can just go right to our link at oralhealthwisdom.com. And again, I did put the link to the survey in the chat box and would welcome your feedback and appreciate you attending for today.
Thank you so much, everyone.
Thank you.
No, thank you.
Hope to see you next month. Thanks, everyone.
Thanks.
Thank you.